Welcome to the module for Motherhood Unlocked, Babies and Babbling. And we have Claire, a speech therapist here that's going to talk with us a little bit about some of the things that we think about early on in communication and how we can prepare for that and manage that. So I'm going to let Claire introduce herself and we'll get started.
My name is Claire Byrne. I am a speech pathologist who can't speak.
I have back pain. Big deal.
It's fine. I graduated from University of Iowa with my master's in speech pathology, and I've worked kind of like across the spectrum of early intervention. I've worked in outpatient pediatric clinic. I've worked with geriatric population in hospital, nursing home setting, so kind of across the lifespan. I also am a certified Montessori primary teacher. So I have that. At one time, I held a breastfeeding lactation counselor certificate, which I did let lapse, but I still have the knowledge. Just didn't want to continue paying the dues.
Right. I hear you on that. Just as a reminder, I'm Dr. Kelsey. I'm a physical therapist, and Claire and I actually met through a Fit for Mom class where she was the teacher, and she's since moved away from Vegas now. But we have talked a little bit about speech, just kind of amongst our workouts and that kind of thing, because she has two little kids, and I have two little kids that are a similar age. So that's why I wanted to bring her on to be able to talk about those tactics and like really how it is to experience communication as a mom of little kids, but also someone who holds those credentials. Because there's a lot of information out there, and some of it's coming from your pediatrician, some of it's coming from friends and family. So it's hard to decipher that. So initially, one of my main questions is that I see a lot as a physical therapist is, when should a baby start talking? That's should it be by their first birthday? A lot of things seem to happen by their first birthday.
So in terms of communication, one thing I like to differentiate between is speech and language. So speech is, the actual production of sounds, Language is assigning meaning to words. Like, this is a phone. Mm-hmm. This is a plate. So putting those speech sounds together, but language can also be gestures. It can also be signs, mm-hmm. and it also includes understanding or comprehension of, go get the phone, but don't.
Right. The command of
there is your ball.
Choose, that kind of thing.
Yes, right? Exactly. And so language, it doesn't seem like it starts right away, but that comprehension has to come first. So that is the foundation of language, is being able to comprehend, water, bottle, mama, putting those labels to things, first hearing it and understanding it before being able to produce that. In terms of the actual production of words, can come as early as, 9 to 10 months. Kids will start to say mama usually first. And then by around, 15 months, they might have 5 or so words that they say. Just as an anecdote, my daughter, she's 5 now. When she was about 6 to 9 months, I told my husband, she's not babbling. And I was like, I know she should be babbling, and she's not babbling. Right. And sure enough, later on, at 18 months, when I wanted her to be saying, upwards of 20, 30, 40 words, she was saying maybe 5 words, but she had 50 signs. And so that speech versus language, she knew the labels. She could do milk, more, peach, whatever. But the sounds is what she was having trouble with. And, as a speech therapist, I was like,
yeah, absolutely. I mean, I was like that with crawling. I was like, you have to do this. And so, Of course, kind of my little case studies, which, that's a whole other topic. But yeah, It is hard to feel like maybe other kids, even if you're not a provider. So even if you're not a speech therapist, if you have like a niece or nephew who's around the same age as your child, and they're doing some different things, and they're babbling, like you were saying, kind of around that same window of 6 to 9 months that we would want them to, or we would want them to, and then your child is not, that can feel really personal on that level. And so
it's so easy to compare. And it's important to recognize that there's a range for all of these skills. Physical therapy or gross motor skills, speech skills, communication. But, kind of having a lookout for those different things is also just to be aware.
Sure. And then when it comes to, that's a good question. That's good kind of like dovetail question into, you had mentioned that, okay, so around 6-ish to 9 months is we want to hear some more babbling happen. The other thing that you mentioned was that she had a lot of signs that she was utilizing. So sometimes one of the things I've also seen and have parents ask, is it bad to learn sign language because they may not have the same communication, kind of like that? Or is it similar with language, other languages, like a secondary language or a family's generational language?
Sure. That's a great question. And same story, my mom was like, well, she's not speaking because she can sign and she knows that we know what she wants. And that is a factor. But in terms of like just knowing what I know, I would never disregard or discourage sign language. I think giving any method of communication is communication. And that's going to give them access to so much, both from parents, from other caregivers. So I would never discourage any form of communication. I think signs, because it helps them learn that there's a symbol that represents something. It teaches them the concept of labeling, of requesting, of making things happen, cause and effect. If I do this, mom's going to give me milk. So I get what I want. I don't have to cry and she doesn't have to guess.
Right. The association is very powerful.
Exactly.
And like you said, the connection between your caregiver, so that there is something that they feel like they're getting out of that. Because I do feel like that can be so hard in that window. If we're thinking, I think you said what, like 5-ish words around, was that a year or no?
Around, a little after a year, they start to pick
a little
up
after a year.
15 months or so.
Yeah. And those kids are doing a lot of stuff. And so in my mind, I'm like, I would rather them have something. I don't necessarily care if it's expressive or if it's sign language, because I want them to be able to help me, because so many tantrums start to happen in that window because they can't communicate.
Right.
And so a lot of times it can be like, well, if you don't have anything, then you really can go, it can be more frustrating for everybody.
Absolutely. And, in the case of my own child, like all the words that she could say at 18 months started with an M. So I know she was having trouble producing sounds because she was only using M plus a vowel. And so if I hadn't taught her those signs, she would only have those M words.
Right.
Mama, milk, more, moo, which moo isn't very functional.
Right. Right. It's fun. The fun.
Right. So she had access to this whole vocabulary that wasn't, and some of her signs were invented by her. And that's also great. Like those gestures are meaningful. And then you as a parent, all you have to do is say, oh, you want dip? You want ketchup? Okay, dip. Here's your dip. And then you give them more repetitions, which repetition is so important for language development, of that auditory signal, so that they can start to hear it, see your mouth as you say it. And then, eventually the signs end up fading away for most kids, unless there's a hearing impairment. And because they find out that, oh, I can yell dip from across the room.
Because you're like, that's going to get me, especially because mom has to be looking at me to see the sign. And so that, like you said, they start to realize that, oh, if I want to have anyone help me, someone could help me, and it's not just this one person. So that's I never even really thought about that visual part and that auditory visual part in that way. And then when it comes to, when we're thinking about, you had mentioned even the lactation or the lactation counselor.
Yeah.
So in that arena, even, this is maybe being watched by someone who has a baby who's a newborn to 6-ish months or beyond. So there's the communication part, but even just with kind of your skills as a going to the feeding therapist, that's also something that I feel like I have seen a lot of crossover. If we're a little more efficient at feeding, it can help with communication. What do you feel like you took away from that portion of your journey? Like the lactation aspect with feeding.
Relating feeding to communication?
Yeah.
Can you be more specific about that question?
Yeah. So sometimes what I see is like, we have, like you said, the signs for communication, milk for feeding, for like breast milk or bottle, whatever.
Yeah.
But then when it comes to even just how much kind of like how effective their motor skills are with their mouth, feeding as an infant, and then going into like feeding for table foods and that kind of thing.
Sure.
Those two seem not related, but I feel like there's a lot of crossover that I've.
Yeah. Okay. So you're talking about like a motor perspective versus
like a motor, which is a little bit less than maybe what most moms think about. But
it is the same musculature. It's the same, your tongue, your lips, your palate, all those things working together in coordination for feeding, in coordination for speech production. So moving on to more speech production. I think there are some ways that we use feeding tools for kids who have trouble with speech. So for example, using a spoon and making sure that they put the spoon directly in their mouth, they close their lips and pull it out. So they're getting that lip closure, which you need for buh. So it's using a straw as opposed to a sippy cup helps develop the lip musculature to say ooh, wah, versus a sippy cup, which is more of a rounded, it really is the same motor movement as a bottle. So that it kind of progresses their development in that way and develops the coordination and strength. So strength and coordination is, two different things to help support feeding. I know there's a lot of like, especially on social media, I feel like there's a lot of like, oh, you should use this bottle versus this bottle. Some of that is just, you got to figure out what works, what works for your child. There are definitely, there'll be that bottle that has like the fat, like milk container portion to be more like breast, where I feel like that's not as important as the nipple itself.
I also agree that I care more about what's happening at the part that's actually in the mouth versus like what they're holding on to at that point. But it is challenging. I think, even that connection of like, even what feeding therapy can look like, or even what practicing sounds with your child in your kitchen can look like, is not always like they're sitting on a tiny chair and they have a flashcard and you're being like, pee, whatever, puh, whatever the thing is. Like that's not fun. No. They're not going to want to do that with you most of the time. So I think that's also something even to think about with, even in this early age of like, you're really managing so much about what's happening in their mouth, what's happening with their visual, what's happening with their auditory senses to get them ready for the next thing. Do you feel like when you've seen, another kind of like hot topic, at least to have kind of a speech therapist understanding, is oral ties and that evolution. So that's an entirely, I just took a 2-day course on that, so we could spend like 16 hours on that. But in your blended mom perspective and your professional perspective, what do you feel like is something you would tell a mom if they're not sure, or if they're in the stage where they're like, something's off, but I don't know if I want to go down this route? Like, what would you tell her?
So, like you said, it's kind of a hot button issue. Some people are like adamantly like, it doesn't matter. Some people are very adamantly like, fix all the tie. It's among professionals, it's very controversial over the past several years, I would say. I would say, you know, in terms of like very, very early newborns, you first might experience issues with nursing or even bottle feeding. I know that there are many women who said that they couldn't nurse their babies because of a tie. And if that's the case, I would definitely, you know, make sure that you find a provider who can maybe give you the pros and cons.
Yeah.
Right. Like you don't want someone to be like, you absolutely must. Whatever.
Yeah, because there isn't an absolute. There really is not an absolute in anything, because we're not living the life that you're living. So
no, exactly.
It's hard to be in that space.
And so, you know, for example, my daughter had a lip tie, which means that her lip was very closely attached to her gums. And that caused me some pain with nursing. But I didn't have to do anything about it. I just kind of was able to adjust positioning based on the knowledge that I had to sort of mitigate that. And then as she became even like a week or two older, she was able to also accommodate and didn't have any other issues. And so she was able to be functional with nursing without addressing it from a medical perspective. Whereas I know like some kids have those posterior tongue ties that are kind of hard to detect sometimes, but they really struggle with figuring out how to move that tongue for those very early feeding, whether it's nursing or bottle feeding, you know, and it becomes very frustrating for, you know, parents, either there's weight gain issues or it's just very what's the word?
Uncomfortable.
Yeah. It's just,
I hear a lot of like, they're feeding fine, but they're so gassy and they're uncomfortable.
Yes, exactly. Uncomfortable for everyone.
Which is hard. Yeah, hard for everybody. Yeah.
I think, and, you know, doing your research as far as like, is this provider, or ask the question, even if, you know, if you don't have the ability to, you know, have you taken a 16-hour course on tongue tie? You know, what's your knowledge level?
Yeah.
Because you may have a provider who is like aware that it's a thing, but not really aware of how the options of how to address it, or, you know, whether or have only one strong opinion about what to do. So I think, you know, empower yourselves to ask those questions. Like, have you done any additional education on tongue tie? Because all providers have to do additional education, but they can choose on what that education is.
Because that was never, I don't know in your training as a speech therapist. I mean, it makes sense that it wasn't ever in my training as a physical therapist. That was a lot of the specialty aspect of what I do. But with speech therapy, or speech and language pathology, was that part of your training at all?
Not really. I remember when I was a clinical fellow, so after graduating from grad school, you have to do a supervised year. I remember getting a 1-page handout from my supervisor on ankylosing, which is tongue tie. And she was like, it's a controversial topic. So like, from going through the lactation counselor course, which was a 45-hour course, there was a little bit of it. And so I've looked into it on my own and like had discussions with other professionals and taken some courses here and there. I haven't taken a 16-hour on tongue tie alone, but maybe that'll be what I'll do next.
It was really good. It was through Talk Tools. So I was the only physical. I was the only physical therapist in the room. But it was very good. It was great. And that's part of the, you know, the evolution or the gray area with parenting. And that's part of the theme through any of these modules, is that really understanding the information and what objectively is there, but then also how that applies to you and your life.
Right.
Like, for example, when I had my second son's tie released, I was not in the same headspace when I had my first. My first son was 3-ish at that time, almost 3-ish, almost 4. And I was like, oh my gosh, we should have done with our first. He had drooling, he had open mouth breathing, he had now into like a 6-year-old I can just see his teeth are going to be, he's probably going to have an expander. Like, his speech is not super great. He's not in therapy for it because he passes the test, so to say. But I'm like, oh, it's a little cringy sometimes so there are these things that you have to understand where you are. Like, I knew at that moment, I was like, there's no way this is going to work with a newborn release, a 3-year-old being released, and us being in a town where we don't have our family or friends here, and we're building family or friends.
Right.
Like, it's just not going to happen. I was going to be working full time anyway. So with anything, when it comes to communication, when it comes to, is my baby babbling? Are they feeding correctly? You do have to integrate it and apply it to what daily life you're living.
Absolutely.
Because that would have caused us so much extra. We already had a lot going on. It would have just caused us so much extra stuff. So at this point now, really, with like communication for him, I'm just looking at how can if we were going to do anything, it would be myofunctional therapy. So it's going to be supporting that until he gets old enough to where I can legitimately say, because right now I'll be like, if you want to breathe better so you can play baseball better, then this is what we have to do. And he kind of understands it, but he's like 50-50 on that.
Sure.
But I'm kind of like building that so that when he's like 10 and he really is involved in something, and I'm like, you want to be better at this thing, this is part of taking care of your body. So it's like, that's the long game. But when it comes to like when they're so little, do you feel like there are things that maybe is like one thing that you did as a speech therapist mom that maybe you felt like you were telling other mom friends that you would do it and they'd be like, oh, I didn't even think to do that with my baby? Is there something that you would like, super easy strategy to?
In terms of, are we moving on from tongue tie?
Yeah, just in baby.
In general. Okay, gotcha.
In general, just to be like, oh, I'm feeling good about communicating, helping my baby with communication. And they're like 4 months old.
Sure. One, it's never too early to read to your kids. Yeah. That you'll hear that from everyone, I'm sure. 2, songs are amazing. They're repetitive, they're entertaining. You can pause and then fill in the blank. And then as they get a little bit older, not 4 months, but maybe, by a year, twinkle, twinkle, little star. And you're not trying to like pull it out of them. It's just fun. You're just giving a pause. Like a pause is very powerful. Or if they want something, again, a little bit after 4 months, but you want milk. Milk. Just repeating the key word multiple times with no expectation of them repeating it back, right? You're not like you're not like, I'm holding this until you say milk.
Sure.
Because that's just frustrating. Think of it as teaching them the word and not testing them.
Right. Because they're emotional at that age, their emotional level is going to supersede what the thing is, because they don't really they have an association with that item somewhat enough to want it, but they also have more of an association of when they feel angry and upset, and they're going to go to that way faster than the thing. As they get older into toddler years, yes, there's like that given push of like, I really do want the sticker. Is it like, okay, they start to build that. But yes, in those early months, it's like, they're just going to be mad. They don't care.
It doesn't have to be long, not a long pause.
No. It's just more of that aspect.
And then, just like have conversations with your baby. Yeah. And see what they do. They might respond with like a good. And you're like,
right.
And yes, I know. But like, give it meaning to the context that you're in. And then that's just teaching them prosody or intonation. It's teaching them give and take back and forth. It's teaching them different sounds and words in the language. There's so much with communication, and that social aspect of communication is also so important.
Being around
again, that comprehension has to come first. So the more they hear, And it's very easy to overdo it, I will say. Like, and overdo is maybe a strong word, but like it doesn't have to be constant all day long, you know.
Right.
You don't have to narrate your entire life. It's okay to be quiet for a little bit too.
Yeah, because they're not going to be quiet. So why don't you take some of that time to be quiet? So that they're like, oh, this is what we're doing. And one last kind of clinical question. Sure. When it comes to just for as a mom going into a pediatrician's appointment, maybe they are a first-time mom, or maybe they've never had this question before with their baby. But when it comes to, can you just speak to for a minute on receptive and expressive? So from a speech language pathology standpoint, what does that mean? And then how does that apply to like a pediatrician visit and when they're asking you what baby is saying and that kind of thing?
So receptive language is that comprehension aspect. It's what they are taking in. It's, do they point to pictures by maybe 12 to 15 months? Do they follow a one-step direction, like go get your shoes? Do they identify familiar people? All those things are receptive language, hearing a word and associating it with something without having to say anything. Expressive language is what you say, could also be what you gesture. Waving is expressive language. Clapping, that's expressive, like you're expressing joy. Or signs, more, or words, more. You know, that speech versus language in terms of expressive language, there is definitely a developmental progression of what sounds they say. So, you know, for example, my younger daughter has a best friend stuffed animal named Pablo. And when she first started labeling him, she said, Ma. And that was her word for him. And then it was Mapa.
Oh, I see what you're saying.
And then it was Pabo for a long time. And then she just started saying Pablo. And that's all developmentally normal. So even if expressively they're calling
the cup,
wa, you know, they're not saying the whole word. That still counts as a word. So if your pediatrician is saying, how many words does your child say? If they say wa and they say woof for woof, and they say, you know, ha for hair, those all count. Right. And sound effects also really count.
Because they're consistent for the thing, right?
Yeah. Okay. So it doesn't have to be the adult production for it to be a word. So just keep that in mind, because parents will be like, oh, they only say, you know, 5 words, but really they say 20 words. They're just not all like perfectly clear. Yeah, but if they use the same reference, ba for bottle every time, that's a word. They're representing bottle with the object. They are associating that in their mind. And so that counts as a word. And then as they mature, their production will get better. One thing I always try to say to parents is that you as the parent want to say the word the way you want them to say it. So if you want them to say, so another example, my 3-year-old calls the washing machine a wash-a-shinger. And I think that's adorable. So I'm just like, okay, we'll call it wash-a-shinger. But if I keep saying wash-a-shinger, she's going to also keep saying wash-a-shinger. Yeah. So if you want them to say the correct word, it's not like you are correcting them. But, you know, if she says, it's in the wash-a-shinger, and I'm like, oh, yes, it's in the washing machine. You're right. You know, I'm not like, no, it's washing machine. Yeah. Just like kind of repeating it back.
And that's
the way you want them to say it.
Part of that no expectations, no to low expectations within the appropriate range is that, like you said, it's not like you're having to be like, oh, my expectation is that this drill, I'm going to drill you on this every time. And or even kind of the concept of the baby talk, which I do remember this kind of coming like coming around or happening with my first, and that was like 6 years ago. And I think I remember my mom being like, oh, like, what, like, I guess that makes sense. Cause I was like, we don't really do baby talk. Like I will talk to him. I'm not like talking to him like I'm talking to my husband if I'm like being stern or whatever, but I'm using the same words that are the words we would use instead of like wah wah or something like that. If it was something that I was trying to just have a normal conversation, or I might do it in a higher tone because that's like a mommy voice, but I wouldn't necessarily evolve what the word is saying. And that was something that was kind of interesting for her. She was like, oh, I guess that does make sense. Unless, like you said, it's kind of like a cultural or a family thing where you're like, oh, that's so adorable. Like, we're going to keep doing that until obviously you're going to be like,
eventually, but you don't want to do every single word in baby talk for sure.
Correct.
But like you just mentioned, the mommy talk or motherese, like that's also, it's very attention grabbing for kids. So it's actually recommended to use that like higher intonation, like, oh, I see you have a doggy, you know, and you're using real words, but you're just kind of drawing their attention more to those changes in your voice. And it also helps them to kind of parse out where the words stop. Because that's, oh, see, I have a doggy. That's 6 words, right?
Yeah.
But if I just say, oh, I see you have a doggy, like that could sound like one word.
Yeah.
You know, like if you're listening to a foreign language.
Yes.
You don't know where the words start and end. So that motherese is actually something that I would always, you know, encourage.
Right. Because I love it. And especially in that new baby time frame when they're really looking at you, like when they're really just like engaged in what you are, because you're kind of their whole world. They're not really aware of the rest of the things there, which is whoever they're with. So those are all of my kind of main topics or main things that I wanted to get across to the moms in this age group. Do you have anything that you want to share, or anything like one thing that you would want to say to the moms about kind of communication, just general motherhood even?
I would say that generally babies and kids are amazing language learners. And it's like watching magic happen when they like figure stuff out. And it doesn't have to be anything complicated to help them on that journey of learning language. You know, songs, books, motherese, repetition, gestures. Like I said, you can make up your own signs, because unless you want them to last forever.
I mean, there is American Sign Language if you want to be like very specific to that. But
and there's baby sign, and there's all those baby sign videos and things. You know, the more, I guess one thing I would add, just talking about baby sign videos, apps and technology are great. They are not a substitute for communication. So an app might teach a baby to imitate a word like apple and show a picture of an apple, but it's not teaching a baby how to use that word in real life. And so there's no substitute for face-to-face, person-to-person communication. Like that's the best thing that you can give your baby. And like, of course, my kids use technology like everyone does.
I mean,
but
if you're wanting to get across that aspect, being able to have communication in front of you is great. So I think that's all very valuable information and stuff that's realistic too. I mean, these are just designed to be able to give moms kind of a little extra information outside of our group that we meet in person one time over 6 weeks, and we go over certain topics in person, but sometimes we just can't get to some of those stuff and those topics. And so communication, car seat, balance, like motherhood balance, which is kind of a misnomer. It's just called all moms work. is what it's called.
That's true. Yep.
Yep. And then it was ask a pediatrician was the other one. So it's just some of those big highlight things that are still out there and still are helpful in this first 6 months, but it's not necessarily something we can all pack in. So thank you again for your time. You've so much information. And I know that as far as some of the other people that have been on the modules, you're not doing anything in clinic or anything like that right now, but I usually will I have texted or talked to Claire before about some of the other things going on with my kids. And so she's a wealth of information. So thank you so much again. And we will end. Thanks, moms. And we'll see you on the next one.
Awesome.